Hello, and welcome to this presentation on study-specific safety concerns. We will be looking at a number of different concerns that may impact participant safety in this study. Let's begin by discussing side effects associated with the study medication tirzepatide. The most common side effect of tirzepatide is gastrointestinal symptoms. These are also side effects with opioid medications, so it should not be a giveaway that the person is taking tirzepatide if these symptoms appear. Here are some suggestions for managing these symptoms should they appear. It's important to note that nausea and vomiting is more likely to happen on the day of injection or the first day afterwards, and then improve after that. Things like eating smaller meals or walking after a meal rather than lying down, avoiding greasy or spicy foods, and drinking plenty of fluids can help with the nausea and vomiting. Drinking plenty of fluids is also helpful for diarrhea or constipation. Pepto-Bismol, which is bismuth subsalicylate, can be helpful for nausea, vomiting, and diarrhea, while increased fiber or milk of magnesia can help with constipation. Other medications may be considered for symptom relief, and ginger, peppermint tea, or candy may be helpful for nausea. Because we anticipate most of the participants will experience GI symptoms, either from their buprenorphine or from tirzepatide, the unblinded medical clinician will provide all participants with a handout with tips for managing these effects at the time of the first injection. We will be monitoring these symptoms using the gastrointestinal symptom rating scale at screening, at the 3 extended visits, and whenever a participant is eligible for a dose increase. This form may also be administered if the participant complains of gastrointestinal symptoms during the study. There are a number of rare but serious side effects associated with tirzepatide: severe hypoglycemia, acute pancreatitis, acute kidney injury, which is typically related to hypovolemia, a worsening of diabetic retinopathy, which does not apply to individuals without diabetes, an allergic reaction, or thyroid C-cell tumors. Additionally, kidney function may be impaired due to dehydration caused by insufficient fluid intake while on tirzepatide. These issues are taken under consideration when determining eligibility for the study and are assessed during the medical and psychiatric history. If any of these emerge following randomization, the blinded medical clinician physician should evaluate the safety of continuing on the medication. The lead team is available to assist in assessing the best path forward and must be consulted prior to determining if the participant should be discontinued from medication. Now let's discuss injection site reactions. Significant site reactions are expected to be infrequent with either tirzepatide or placebo. When they occur, most reactions will be mild and will typically resolve on their own without intervention. The most common site reactions are redness, swelling, pain, itching, and tenderness. In these situations, the BMC may suggest a cold compress or over-the-counter medications to help resolve the symptoms. In the event something more serious occurs, the site should be evaluated for infection. In the rare event that a site develops abscess, ulceration, or necrosis, the study medication should be stopped temporarily, and the BMC should evaluate and ensure appropriate treatment is obtained. Another potential side effect of taking tirzepatide is hypoglycemia, although this may be caused by other situations as well. Sites will monitor for this throughout the study through A1C blood tests at months 3 and 6, with additional testing as needed due to symptoms. Site budgets have included funds for glucose meters and test strips. If participants exhibit symptoms of hypoglycemia while on site, study staff will test their blood sugar and consult with a blinded medical clinician. If this occurs, or if the participant reports experiencing hypoglycemic symptoms away from the site, They will be given a blood glucose meter and strips, along with a participant diary, and instructed to check and document their glucose levels anytime they have a symptomatic episode. The glucose meters will be returned to the study site once the symptoms subside, or at the end of the participant study involvement, whichever comes first. If a participant has a blood glucose reading of less than 70 milligrams during a hypoglycemic episode, the BMC physician will reach out to the lead team for consultation to determine if the participant should be discontinued from study medication. It's important to note that all symptoms of hypoglycemia are pretty nonspecific and can have other etiologies that may or may not have to do with hypoglycemia. In general, these are autonomic responses, such as sweating, hunger, weakness, tremor, anxiety palpitations, and paresthesias. If the brain is unable to get sufficient glucose, symptoms like irritability, confusion, and behavior change may occur, and in severe cases, even seizures or loss of consciousness. If these symptoms appear, check the participant's glucose. If the glucose level is 70 or greater, the BMC should evaluate for other causes of the symptoms. If the participant is able to swallow safely, you can give them 4 ounces of fruit juice or other fast-acting source of glucose. Of course, for serious symptoms, the BMC may need to take emergency action based on your site's local procedures for medical emergencies. At the time of their initial injection, all participants will be provided with a patient education brochure about hypoglycemia to assist them should they experience these symptoms during the study. We do not anticipate the study medication to cause depression or suicidality. However, those concerns may be associated with having an opioid use disorder. When these symptoms appear, they can cause safety concerns that need to be addressed. In order to reduce safety concerns around suicidality, we will be excluding candidates who have had a suicide attempt in the past year or who are assessed as having current suicidal ideation at the time of screening. Once randomized, suicidal thoughts and depression will be monitored weekly through study assessments. Anyone endorsing depression or suicidal thoughts will need to be assessed by a qualified mental health professional using the Concise Health Risk Tracking Clinician Behavioral Module, better known as the CC2, prior to leaving the visit. In the event that the mental health professional confirms active suicidality, the BMC physician will contact the lead team for a consultation about discontinuing the participant from study medication, and local procedures for managing suicidal participants will be followed. Keep in mind that tirzepatide is FDA approved for weight loss, so we anticipate that many of our participants will experience this. In fact, some of them may have signed up for the study in hopes of losing some weight. Rapid weight loss can occur with tirzepatide, particularly if participants are not taking in sufficient amounts of protein or other nutrients due to not feeling hungry. Unfortunately, rapid weight loss can cause some health issues, such as acute cholecystitis, gallstones, low energy, and hair loss. Also, if a participant has underlying depression, rapid weight loss can make that worse. Study teams should be on the lookout for complaints of this nature and should consult with the BMC if they occur. They may also need to be reported as adverse events. To manage the potential for issues associated with rapid weight loss, we will be monitoring the participant's weight on a weekly basis. If the participant's BMI drops to 20 or lower, their study medication will be suspended. If the participant returns to a BMI above 20, they may restart medication at 2.5 milligrams based on the judgment of the BMC physician. BMC should also be aware of the potential for dietary-related problems, such as electrolyte imbalances and nutritional deficiencies, and provide guidance to the participant to address those. You may remember from previous presentations that tirzepatide can reduce the effectiveness of oral contraceptives, and that there are animal studies indicating a potential for negative fetal and pregnancy outcomes for persons taking tirzepatide during pregnancy. Therefore, we need to ensure that pregnant or breastfeeding participants are not randomized, and that participants of childbearing capacity do not become pregnant during the course of the study. Participants who are found to be pregnant at screening will not be included in the study. After randomization, participants who become pregnant will be discontinued from the study medication following a consultation between the BMC physician and the lead team. If a participant indicates they are or might be pregnant, study staff will confirm this using a study urine pregnancy test and report the results to the BMC physician. Remember that prior to randomization, a cisgender female of childbearing capacity who is having intercourse or planning to must use adequate birth control. During the course of the study, these participants may indicate they are no longer using adequate birth control or want to stop using it. If this occurs, and the participant is unwilling to use adequate birth control for the remainder of the study, the BMC physician will consult with the lead team and the participant will be discontinued from study medication. If the participant returns to using adequate birth control during the course of the study, the BMC physician will evaluate the situation and may offer to restart the participant at the 2.5 milligram dose if deemed clinically appropriate. As a reminder, all untoward medical events will be reported as adverse events for this study. As appropriate, some of these will be captured as serious adverse events or as adverse events of special interest as well. Just as a refresher, adverse events will be collected at every visit after the initial consent visit. At each post-consent visit, study staff will ask the participant how they've been feeling since the last visit to elicit any concerns. The participant may also self-report issues as they arise. All adverse events must be reported in eClinical within 7 days of anyone on the study team being notified of the event. If the event meets criteria as a serious adverse event, those must be reported in eClinical within 24 hours of study staff learning of the event. For TAB, 3 types of hospitalizations will be exempt from being reported as serious adverse events. These are admissions for detox, for labor and delivery, and for elective or pre-planned surgeries. The TAB study has several adverse events that have the special designation of adverse events of special interest. Now, these may or may not also be serious adverse events, but in the case of an adverse event of special interest, additional information will be gathered on the SAE reporting form, which is the AD2. The first of these is severe hypoglycemia, which for this study is defined as a low blood sugar event that's associated with severe cognitive impairment, which could include coma or convulsions, which requires external assistance by another person to actively administer carbohydrates, glucagon, or take other corrective actions. Also included are a BMI below 18.5, major adverse cardiovascular events such as cardiovascular death, non-fatal MI, non-fatal stroke, or hospitalization for heart failure, and hepatobiliary disorders, including biliary colic, cholecystitis, and other gallbladder disease. Other adverse events of special interest are severe GI events, like severe nausea, intractable diarrhea, or persistent vomiting. Acute renal events, such as acute kidney injury or renal failure, suicidal behavior, or pancreatitis, which is defined as having the presence of 2 of the 3 of the following: 1, upper abdominal pain, 2, amylase or lipase levels 3 times the upper limits of normal, and 3, imaging showing inflammation of the pancreas. The remaining adverse events of special interest are C-cell hyperplasia in the thyroid and thyroid malignancies, and allergic hypersensitivity reactions, which include severe injection site reactions or anti-drug antibody formation. Thank you for joining me for this review of the study-specific safety issues. Please reach out to the lead team if you have any questions.